Surgery is permanent. It's invasive, has long recovery periods, and there's still no guarantee of success. But what if surgery was not necessary? What if the answer to your spine or joint pain was not another surgery, steroid injection, or prescription, but the solution was something your body already has? Right now, you're carrying regenerative cells with the power to repair damaged tissue, reduce inflammation, and restore mobility. And most people don't even know they have these tiny but powerful cells. Hi, I'm Dr. Heather, and in this video, I'll introduce you to one of the most advanced treatments in regenerative medicine today, autologous cellular therapy. I'll explain how it works, what it treats, how it compares to PRP, and why patients from all over are choosing our clinic for this breakthrough procedure. If you're looking for more than just pain management, but want to avoid the risks of surgery, this could be exactly what you need. So, what is autologous cellular therapy? Autologous cellular therapy uses regenerative cells from your own blood or bone marrow to help heal damaged tissues naturally. It's a safe, non-surgical procedure that works with your body's own repair mechanisms to reduce pain and restore function. What does it treat? We use cellular therapy to treat joint and spine pain, chronic musculoskeletal injuries, tendon and ligament damage, early arthritis and overuse injuries, and more. It's especially effective when performed early, but even chronic cases often respond well. How does it work? First, we draw your blood or harvest bone marrow depending on your treatment plan. Next, we process your sample in-house to isolate potent regenerative cells. Then we inject those cells precisely into the area of injury using imaging guidance. Then finally, the cells go to work, reducing inflammation, signaling repair, and rebuilding tissue. How is cellular therapy different from PRP? PRP therapy uses your own platelets circulating in your blood to stimulate healing, which is great for mild to moderate injuries. But sometimes your body needs more. Cellular therapy adds a deeper level of healing by introducing regenerative cells that can actually rebuild tissue, not just signal repair. Think of PRP as turning on the body's healing switch, while cellular therapy brings in the actual repair crew. What types of cellular therapy are available? We offer two advanced forms, BMAC, or bone marrow aspirate cells. This involves drawing cells from the back of the pelvic bone. And V cells, very small embryonic-like stem cells. These are drawn from your blood using a proprietary technique available at only a few select clinics worldwide. These V cells are also made in your bone marrow, but we don't have to go into your bone marrow to get them. While we offer both options, most patients choose the V cells because it's less invasive and just as effective, often even more so. What are the risks or drawbacks? Bone marrow-based procedures can involve mild to moderate discomfort and a short recovery at the donor sites. That's why many patients prefer the simple blood draw option we offer. While cellular therapy is a bigger investment than PRP, it often delivers longer-lasting results, making it a smart, regenerative alternative to surgery. How long does it take? Most treatments take 30 to 60 minutes. They're outpatient, require no general anesthesia, and have minimal downtime. How long do results last? Many patients experience relief that lasts 1 to 5 years or more, sometimes after just one treatment. So what makes our approach different and so effective? Number one, we treat more than just the joint. We treat not only the injured area, but the entire region. We have found that regenerating and strengthening the surrounding ligaments, tendons, and supportive structures provide incredible stability and regained or improved function. We call this your new normal. Number two, we offer powerful therapy combinations. Cellular therapy is often paired with PRP, other healing proteins also in your own blood like IRAP, as well as peptides, medical devices, or other advanced modalities for maximum healing potential. And number three, we keep everything in-house. From cell harvesting to image-guided injections, every step is performed by our experienced team using world-class, cutting-edge equipment, ensuring quality, safety, and better results. Our goal is to get you optimal relief and results with a single comprehensive treatment. In summary, autologous cellular therapy is a safe, natural, and non-surgical option that uses your body's own regenerative cells to repair tissue, reduce pain, and restore mobility, often in a single outpatient visit. It's a powerful alternative to surgery, and for many patients, it's been a life-changing solution. If you're ready to find out if cellular therapy might be a good fit for you, text us at 239-323-5509, click the purple button on this page, or click the link in the description to schedule a consultation. You may not have to live in pain or require surgery to move freely and feel strong again. Let's find out if your own healing regenerative cells can help you reclaim your active, pain-free life. And if someone you love is struggling with joint or back pain, please share this video with them. Cellular therapy might just be the non-surgical answer they've been looking for. Thanks for watching. I'm Dr. Heather, and I'm here to help you live your best life ever.